I believe that it's not just at the Natural Birth House, but all birth centers throughout the country take pride in their good quality newborn care. What is routine newborn care at a birth center? Hey mom, is it your CajunStork here, Midwife Kyra? I believe in truly natural birth because I know it makes for better birth experiences. Consider subscribing to my channel and joining in today's conversation about caring for the newborn at the birth for a birth center. So let's talk about routine newborn care at a birth center and what's included so that you guys can have a better understanding of how midwives keep babies safe. So first of all, newborn care actually starts in pregnancy. Midwives deliver low-risk, healthy pregnant women and their newborn babies. And so to stay low risk, clients have to meet a continuous low-risk criteria during their pregnancy to ensure that it's safe for them to deliver here for their birth. Routine prenatal care, lab work, and ultrasounds are all included as part of the care with midwives. And then at the onset of labor, clients must be termed, so we don't do premature babies, head down, and not meet any absolute risk criteria that would risk a client out of our practice. An example of this would be like a known breech in birth, gestational diabetes with insulin in Louisiana. We're not allowed to care for women for that. Known twins or epilepsy with medication, those kind of things. These would be absolute risk criteria that would risk a client out of our practice before the birth even begins. During labor, fetal heart tones are monitored with a Doppler using intermittent monitoring, which means that during labor, we listen before, during, and after a contraction throughout the active labor process at least once every 30 minutes. And this is backed by evidence that is shown to be a very safe way to monitor babies during labor to make sure that they're healthy. During the birth, there's a minimum of at least one skilled NRP certified staff member whose sole responsibility is to care for the baby after the birth. That staff member is dedicated to the baby to provide resuscitation should it be necessary. We do carry ambu bags at the birth center to resuscitate our babies, along with pulse oximetry, which tells us the baby's oxygen status. We also carry oxygen to our birth so that we can administer oxygen and we can use the pulse oximeter to make sure that baby is responding well, that everything is going well, or if we need any extra assistance. In the instance of meconium, we do have suctioning devices over here at the birth center should that become necessary. And we just have all the tools on hand that you would expect to keep babies safe in an out-of-hospital setting. The birth itself is done in a clean environment. We use obviously sterile equipment when we are separating the baby from the placenta by cutting the umbilical cord. Babies are delivered and go immediate skin to skin with their mothers. First hour breastfeeding and skin to skin is routine and encouraged over here and for pretty much all birth centers in the country. Cord blood can be drawn and sent off to the lab to assess the baby's blood type and RH and rule out any signs of infection should the membrane's been ruptured a little bit too long. We also provide medications for the baby, eye ointment to prevent blindness, vitamin K we can administer either injection or by mouth at the birth center, although injection is what's recommended. We also can assess glucose levels on the baby here at the birth center. We typically only save it for special circumstances, but for large babies, we definitely check it to make sure there's no signs of like low blood sugar so baby can transition easily. And although we're doing consistent vitals in the first hours of life, the lights are dim and our voices are low, and as long as everything's normal, we just treat baby as if everything's normal. Groupie strep positive mothers are going to be offered IV antibiotics prophylactically as recommended by the CDC. In addition to that, obviously we also assess APGAR scores, which is a score that we give your baby to kind of look at their transition earth side, make sure that they're doing well. Within a few hours of the birth, the midwife is going to provide a complete comprehensive head to toe newborn exam, the same way that the pediatrician does at the hospital. Everything from listening to the heartbeat to make sure there's no murmurs, that the belly's soft, that all of baby's reflexes are there, and a head-to-toe assessment making sure baby is completely normal. What I really love about newborn exams at the birth center, that dads get to be involved in the newborn exam. I'm sure you're following us on Facebook or Instagram where you see daddies hanging up the babies and the cute little scales, and daddies get to call out the weight. And another thing that I love about newborn exams over here in a birth center is that if baby's just not tolerating the newborn exam, like baby really just wants to snuggle with mom, no problem. We'll put off the newborn exam a little bit longer and let baby just have a peaceful few hours postpartum. Using the pulse oximeter, we do also do the CCHD heart screening on the babies within 24 to 36 hours after the birth. We actually do this in the patient's home, which is really nice because moms don't have to like leave their houses after they give birth. And we can also do any necessary lab work on the baby, such as jaundice, PKU testing after the baby's born within 24 hours. We're going to file the birth certificate for the baby so baby can become a cool little legal American citizen. And we encourage our mamas to go within 3 days to the pediatrician to establish that relationship. You know, babies are really, really important to us. Obviously, we're midwives, we deliver babies. And we really want to make sure that our babies are cared for and that our families feel confident in their choices. If you have any questions about the newborn exam or, you know, the kind of care that we provide here at the birth house for our newborns or any birth centers in the country, let me know in the comments below. Otherwise, I'd like you to watch how we perform a newborn exam in this video right here. Give you a little sneak peek at a cute little baby while we do that. Thanks for watching this Midwife Monday. Bye-bye.